guys, my name is Kayla, and I am with Group 4. That is with Christabel, Donna, Jenna, and Rachel. We are doing Improving Health Equity Through Value-Based Payment Models. So my assignment question was, who is this methodology targeting? So is it targeting providers, hospitals, a specific condition, etc.? So I'm going to go over all of that in detail with you. So the primary target for value-based payments or value-based care is healthcare providers. I actually work for a primary care office here in Marion, and we only do value-based care. So let's see, value-based payments, which is also known as VBP, if you see the acronym around, it models directly incentivized providers to improve quality, outcomes, and reduce disparities. So basically, the primary target is healthcare providers. The targets include primary care physicians, specialists, community health centers, accountable care organizations, ACOs, federal qualified health centers, which is known as FQHCs. These are the frontline professionals driving value-based payment success. Secondary targets is like hospitals and systems. Hospitals are key players, especially those serving understaffed populations. Under VBP, they participate in bundled payment or shared savings programs. They invest in care coordination and community outreach, and they screen for social determinants of health. And the third target would be cross-cutting targets. So like populations facing disparities. So VBP indirectly benefits populations with health disparities. So that's like racial and ethnic minorities, low-income and rural residents, people with disabilities or chronic illnesses, and it encourages outcomes by rewarding care that meets diverse needs. So to sum this all up, VBP indirectly targets those most at risk for poor outcomes by incentivizing the healthcare system to meet their needs with equity and compassion. So again, all the information that I have given you answers my question to who is this methodology targeting? And the next question will be on Chris. So hopefully you have enjoyed my recording.
Hi guys, so today I'm going to be talking about value-based payment methods and how does this methodology work. So what is a value-based payment model? This would be a model that is utilized in healthcare reimbursement systems to be able to reward providers. So this would be where providers are rewarded for the type of quality of care that is delivered to the patient, not just the quantity of services that are being provided. So value-based payment method models would be to where a provider is only paid when certain criteria is met. That would be down to the quality of care, cost efficiency, and patient experience. We have a couple different types of value-based payment models, which would be a P4P, which is a pay for performance. We have bundled payments and ACOs, which is accountable care organizations, or capitation or population-based payments. So we have all of these, but the one that the U.S. normally utilizes would be a traditional FFS model, which is a fee for service. This is where a provider is paid for each test or each visit, regardless of a positive or negative outcome. So this is just a little bit of information about value-based payment models.
Hi, I'm Donna, and I'm with Group 4, and I'm covering question 3. What is the intent of value-based payment models? What is the theory behind value-based payment models? And how does this impact expenditures and increase efficiency? Value-based payments are designed to change how healthcare works. Instead of paying doctors and hospitals for every single test or visit, the goal is to pay for better results. The shift encourages providers to focus on keeping people healthy and not just doing more procedures. The idea comes from something called the triple aim, which has three main goals: give patients a better experience, improve the health of the whole population, and lower the cost of care per person. On the slide, you'll see the intent and theory behind this approach. Value-based care aims to improve quality, reduce waste and inefficiency, and encourage prevention, advance health equity, and build a more sustainable system. When care teams focus on preventing problems instead of reacting to them, everyone benefits. The slide also shows two common models used in value-based care. Accountable Care Organizations, ACO, brings a group of providers together, like the doctors, hospitals, and specialists, to take responsibility for both the quality and the cost of care. If they keep patients healthier and avoid things like unnecessary hospital stays, they share in the savings. For example, helping patients avoid readmission through better follow-up care and prevention. Capitalization is another model. Providers get a fixed payment rate per month per patient. This encourages them to focus on prevention and good management of chronic conditions, because healthier patients need fewer expensive services. The risk is if payments are too low, providers might not have enough resources, but good models work to balance this. Overall, the main idea behind value-based payments is that when providers share both the risk and the reward, it motivates teamwork, smarter care, and healthier patients, all while controlling costs.
How widely has this payment methodology been implemented? Value-based payment models have been implemented very widely across the United States. Both public programs like Medicare and Medicaid and private insurance companies use them. Some major examples include ACO, MIPS, bundled payments, and hospital value-based purchasing. Many states have also created their own versions, so the approach is used almost everywhere in the United States. Where has it been implemented? Well, in the United States, states like Maryland and Oregon have a strong statewide model. Maryland uses the all-payer and total cost of care system, and Oregon uses the Coordinated Care Organization system. Internationally, countries in the OECD, such as the United Kingdom, Sweden, and the Netherlands, are also testing and using value-based care systems. What is the impact on cost and care? Studies show that when value-based payment is designed well, it can improve the quality of care and reduce the overall healthcare costs. However, there are still challenges, especially with equity. If the system doesn't support all patients equally, some patients may receive lower quality care. Strong data tracking and support for providers are essential for making these models work effectively.
Hi everyone, my name is Rachel, and the last question we're addressing is what impact value-based payment methods have on the healthcare delivery system and on AAA. So to wrap up everything we've talked about so far, value-based payment methods really do make a difference on how healthcare is delivered. Instead of paying providers for just doing more, it pays for actual outcomes, which pushes the system to focus on quality rather than quantity. When providers are rewarded for outcomes, you see better coordination across healthcare providers, fewer repeated services, and fewer medical errors. That naturally improves the patient experience because care feels more organized and centered on what a patient actually needs. Teams communicate more, data gets shared better, and patients aren't being bounced around between providers. So value-based care also supports population health overall. It encourages early intervention, chronic disease management, and addressing social factors like housing or income when they impact health. So when payments are adjusted for these risks, it kind of helps safety net clinics and hospitals that serve high-need populations and stay supported rather than penalized. And the last part is cost. When care is more proactive, the system avoids unnecessary spending, which means fewer preventable hospitalizations, fewer duplicated tests, and overall better use of money and resources. While savings aren't huge right away, there's a clear trend towards a lower per capita spending and better outcomes over time. So overall, value-based payment methods support all three parts of AAA, which is better care, better health, and lower costs. This takes a good data system and strong leadership to make work, but it's a step towards a healthcare model that makes more sense for both patients and providers long term. So that was everything. Thanks for listening. I hope this helped you learn more about value-based payment methods.